when patients come along for a consultation about having an injectable treatment for the first time, they're often pretty apprehensive. And that's partly because of a lot of the images that we see portrayed in the media of, celebrities looking a bit strange, or they might see, people walking down the street that, have obviously had filler in their lips and they don't want to look like that. So a common concern of patients is that they'll come out of the procedure looking unnatural. So a good way of alleviating that fear is to show them examples of patients that you've treated, and having a good bank of before and after photos to show patients of what a natural sort of realistic result is, will often go a long way to making them feel better. But we find we get a lot of patients through word of mouth, and so they've seen their friends had a treatment and they're happy with the way that their friend looks, and so then they have a bit more confidence to come along and have the treatment. Patients do, I think, legitimately have some concerns about the long-term effect of injectable treatments. In terms of anti-wrinkle treatment, it's a little bit like if a child falls over and breaks their wrist and we put their wrist in a plaster, 6 weeks later when the plaster comes off, yes, their arm is skinny because those muscles haven't been used. But as soon as they start using their arm again, the muscles, come back to being as strong as they were before. And the same thing is true for anti-wrinkle injections. If for whatever reason you decide to stop having anti-wrinkle injections, the muscle function returns very quickly, and everything goes back to being exactly as it was before. On the flip side of that, we do have a lot of patients who have long-term anti-wrinkle injections, and because in Australia we try and have patients looking as natural as possible, we're using pretty conservative doses. So there's not really any concern about long-term effects, particularly of anti-wrinkle injections. Some patients do worry that if fillers are plumping up their skin from inside, what happens when the filler wears off? Will their skin then be saggy? But luckily, fillers actually improve the quality of the skin, so there's no problem with that after the filler sort of is slowly degraded by the body. And I would usually advise patients, though, not to have large amounts of filler put in one area. For a start, it doesn't look very natural. So a classic example of that is the lips. Because yes, if you're constantly putting large amounts of filler into one area, potentially that will have an effect on the tissue over time. But most of the time, that's not a concern. I think, the best thing as a medical practitioner doing these sorts of treatments is that, there's a temptation to transform patients and give them that real wow effect where they look quite different. But, in my experience, you get the best results over time if you just aim for little gradual tweaks every now and then, and just to improve things slowly, because those results are easy to maintain. Patients still look natural. Nobody's going to look at them and say, what have you been doing? And it just means that they're not spending large amounts of money frequently to have these full sort of transformations. They're just keeping it natural and having a lot of little tweaks over time.